Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the chest X-ray, Posteroanterior view, and to identify and will also compare the normal chest X-ray with that of some of the diseased conditions. Let's get the identification of the normal chest X-ray. In a chest X-ray, we first find out that trachea, the windpipe, is centrally located. Trachea bifurcates into the right principal bronchus and left principal bronchus. The last tracheal ring has a nail-like process. We call it carina. Apex of the heart. This is the apex of the heart here. Apex of the heart is formed by the left ventricle. So this is the left ventricle. This is the apex of the heart. Okay, we got that. Then we'll go here. Then the aortic arch or aortic knob. This is the aortic arch, also called aortic knob. Even some radiologists say it aortic knuckle. This is the arch of the aorta. This is the arch of the aorta. Underneath the arch of the aorta, we'll get the pulmonary trunk and left pulmonary artery. Okay, these are the pulmonary artery, pulmonary vein. They are the content of the hilum of the lung. Okay, so pulmonary artery, pulmonary vein are content of the hilum of the lung. Okay, we got that. Then clavicle. This is the clavicle, left clavicle, right clavicle. This is the acromioclavicular joint. Okay, then this is the tip of the coracoid process of the scapula. The coracoid process of the scapula. This is spine of the scapula here, and this is the acromion process of the scapula. This is the head of the humerus. Okay. Then we'll go to the dome of the diaphragm. Here is the right dome of the diaphragm. Here is the left dome of the diaphragm. In this image, they use the word hemidiaphragm. Okay, so this is the right dome of the diaphragm. This is the left dome of the diaphragm. Right dome of the diaphragm is a bit above the left dome of the diaphragm because the right lobe of the liver is bigger than that of the left lobe of the liver. And in some pathological condition, there may be collection of air underneath the dome of the diaphragm, crescent shape gaseous shadow under the dome of the diaphragm in case of intestinal perforation, or after a surgery, abdominal surgery, may get, or maybe the peptic ulcer perforation, there may be gas underneath the dome of the diaphragm. Okay, we got that. And here is the site for the inferior vena cava opening into the right atrium, and here is the site for the opening of the superior vena cava. Superior vena cava receives the azygous vein, not shown here. Okay, and this is the costophrenic angle, also called costodiaphragmatic recesses. This is the cardiophrenic angle. Heart and the diaphragm, cardiophrenic angle. Another one, cardiophrenic angle. This is the costodiaphragmatic recesses or costophrenic angle. Okay, we got that. These are the hilar shadow. We may have hilar lymphadenopathy. Lymph node may be enlarged in case of sarcoidosis, tuberculosis, histoplasmosis, coccidiomycosis, or in lung cancer. There may be enlargement of the hilar lymph node, very much prominent. Even in some lymphoma, we'll get enlargement of the hilar lymph node. Okay, normal person, it is usually small enlargement. It is not very much distinct in normal person. This is the enlargement of the hilar lymph nodes. Okay, this is a chest X-ray of a female because we are getting the soft tissue mass of the breast shadow here. Again, this is the breast shadow. So this is a X-ray of the female. We'll also get the spine of the first thoracic vertebra, spine of the 7 cervical vertebra, spine of the sixth cervical vertebra in the midline. Trachea is a midline structure, maybe a bit right-sided deviated due to crossing by some structure like arch of the aorta. Okay, so it is a midline structure, trachea, and trachea may be deviated in case of pneumothorax. It may be deviated in case of atelectasis or collection of fluid or some adhesion that may be some type of cancer that may also block it. And in some chest X-ray, you may get some equipment like that of the endotracheal tube. There may be endotracheal tube inside the trachea. Okay, endotracheal tube here. There may be venous channel. Okay, we may get that. So in some chest X-ray, you will get that. And in some person may be scoliotic, kyphotic, so vertebra may not be always in the midline. Okay, we got that. Now here is another chest X-ray. Left pulmonary artery. Pulmonary artery should be always underneath the arch of the aorta. Pulmonary trunk and left pulmonary artery. Here we would get the right pulmonary artery. Then the spine of the scapula. Here you get the spine of the scapula. We just discussed the spine of the scapula here. Okay. Here is the spine of the scapula. Here is the spine of the scapula. Okay. Superior vena cava should be here, not distinct in this specimen. Inferior vena cava here, because both the superior vena cava and inferior vena cava opens into the right atrium. Right atrium forms the right margin of the heart. Okay. In cardiovascular silhouette, we get the arch of the aorta, pulmonary trunk, left auricle, left ventricle, apex of the heart. With the apex of the heart, left ventricle, we'll get the left auricle, pulmonary trunk and left pulmonary artery. This is the arch of the aorta. This is the cardiac silhouette on the left side. This is the left side. Okay. And we must know that in X-ray, you always will get some indication who is the patient, what is his age, what is the date, what is the side. Is the L indicates left side, but we can easily understand apex of the heart is always on the left side if it is not dextrocardia. Okay, right dome of the diaphragm is a bit above. This is the right costodiaphragmatic recesses or costodiaphragmatic angle. This is the left this is the right cardiophrenic angle. This is the left cardiophrenic angle. We may get a gas shadow here, a dark shadow of the fundic gas we may get here. We call it fundic gas or stomach bubble. This is the location of the hilar shadow. In the healthy person, it is not very much prominent. In sarcoidosis, tuberculosis, coccidiomyosis, or lymphoma, we'll get large lymph node here. We'll get white shadow here. Okay, we got that. So this is the normal chest X-ray. And we assess the size of the heart, the maximum transverse diameter of the heart from here to here should be half of the maximum transverse diameter of the thoracic cavity. If it is more than half, then we call it cardiomegaly. Okay, we got that. So that is the normal chest X-ray. Now let's get some idea. In the chest X-ray, we may get black shadow, that is the air. Bone and soft tissue, white shadow. Even the consolidation of the pneumonia also give white shadow. Consolidation gives white shadow. Fluid gives white shadow. The maximum transverse diameter of the heart is half of the maximum transverse diameter of the thoracic cavity. And in the chest X-ray, we also look for any fracture in the rib, any anomaly in the rib. We also look for that. Cardiomegaly means enlargement of the heart. There is the proportion between the maximum transverse diameter of the thorax and the maximum transverse diameter of the heart is more than 0.5. That is, the heart is more than half of the maximum transverse diameter of the thorax, that is cardiomegaly. Pneumothorax, air in the interpleural space. It may be due to injury, due to instrumentation. Pleural effusion, collection of fluid in the interpleural space due to many reasons. Lung infection, maybe due to tuberculosis. Pericardial effusion, collection of fluid in the pericardial cavity, usually slow collection, maybe due to tuberculosis, other autoimmune region, we don't know the exact cause, maybe due to a complication of rheumatoid fever, okay, rheumatoid arthritis, or also the rheumatic fever, we may get that pericardial effusion, maybe due to a complication of open heart surgery. Mediastinum, what is mediastinum? The structure in between two lungs. Heart is a part of mediastinum. Trachea are part of the superior mediastinum. Okay, esophagus, descending thoracic aorta are part of the mediastinum. Lungs are not part of the mediastinum. All the structure between the lung are the mediastinum. So mediastinum is the partition between two lungs. Mediastinum may be dilated due to collection of fluid around the pericardium, maybe cardiomegaly, okay, maybe due to the aneurysm of the aorta, ascending or arch of the aorta. Okay, this is pleural effusion, that means collection of fluid here in the costodiaphragmatic recesses. It may be very large, may cover the entire lung. This is the pleural effusion in the costodiaphragmatic recesses or costophrenic angle. Okay, and trachea is here. Trachea may be deviated in case of pneumothorax, usually, maybe in atelectasis. In case of pleural effusion, it is more or less in the midline. Okay, but there is collection of fluid. This yellow color indicates collection of fluid here. Okay, here is the pneumothorax collection of fluid here. I mean the pleural effusion, that is the pleural effusion collection of fluid. Pneumothorax is the collection of air. So effusion, fluid, pneumothorax is a collection of air. We'll get the next image there. Okay, here is the cardiomegaly. Okay, there is the enlargement of the heart. We'll get pneumothorax in the next image. This is the cardiomegaly. Idea is that maximum transverse diameter of the heart should be less than the maximum transverse diameter of the thorax. Okay, we got that. So we got that. Now here is the normal heart, the left ventricle, right ventricle. Here is the left ventricle wall is very thick. Okay, the ascending aorta, arch of the aorta, the right atrium, superior vena cava, inferior vena cava. Okay, here there is enlarged heart, maybe most likely due to dilated cardiomyopathy. Okay, cavity is enlarged here. Cavity is enlarged here. So even it may be larger than that in certain diseases like long-standing hypertension. Wall may not be thinned out, wall may be even thick in left ventricular hypertrophy due to hypertension. Okay, so cardiomegaly means enlargement of the heart, and maximum transverse diameter of the heart should be half of the maximum transverse diameter of the thoracic cavity. Okay, we got that. Now we'll go to the pneumothorax. Pneumothorax means collection of air. This is air, and lung has been collapsed here. It may be tension pneumothorax. It may be spontaneous pneumothorax. Okay, so this is the lung. Lung has a tendency to collapse if there is pressure equalization. Interpleural space is potential space. It is negative pressure. If the air pressure and the interpleural space pressure same, then air get in, lung become collapse. Trachea will deviate to the other side in case of pneumothorax. Here is the lung, here is the air. Okay, we got that. Here is pericardial effusion. This is the heart. Around the heart, we have the fluid collection. Pericardial effusion, long-standing collection of fluid. If it is short-standing collection of fluid, we'll call it cardiac tamponade. Okay, there is an emergency. Okay, but this seems to be a slow collection. It is called pericardial effusion. Okay, we got that. And that's all about the interpretation of the chest X-ray PA view. We like posterior view because posterior view gives us maximum image of the lung and the heart shape. Okay, and that's all about the interpretation of the chest X-ray PA view. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.